Health Beat, brought to you by Shannon Medical Center and Shannon Clinic.
Lung diagnosis requires a delicate and precise process. Shannon's endobronchial ultrasound is a procedure including a scope with a balloon-like ultrasound machine on the end used to identify lung masses, cancers, and more.
So we can actually go into the lung and biopsy lymph nodes that sit in the middle part of the chest, out in the hilar regions of the lung. So we can actually biopsy those at the same time. So the real advantage of this is we can go out and biopsy lesions down the periphery of the lung, get a diagnosis, stage them if it's cancer. So we can then decide if they need to go to the surgeon or the oncologist or the radiation doctor, so we know exactly what needs to be done at the time when we're done with the procedure.
The advantage of endobronchial ultrasound technology is that it allows the physician to biopsy multiple lymph nodes in the center of the chest. This also allows for a decrease in surgical risks and helps diagnose and stage a patient's disease with only one procedure.
So the other thing we can do is there are some patients who have a lung mass or a lung nodule who are not a candidate for surgery because they're not in as good a health. What we can actually do is through the same scope, when we go out and biopsy the lesion, we can actually put some markers around the spot. And so what that does, it allows the radiation oncologist to go in and radiate the area where the markers are. They can't see the lesion of the cancer, but they can see the markers. So they can use their machine to go right down exactly to cone in on where the markers are so that they don't get significant radiation damage to the rest of the lung, and it can go right to the spot where the cancer might be.
With this enhanced technology, patients are able to get procedures and the help they need from the comfort and convenience of San Angelo. For more information, please call Shannon Pulmonology at 481-2158.